Good day everyone, I am Maria Andrea Di Somoria, a first-year nursing student from Our Lady of Fatima University. So for today's video, I will be performing a return demonstration for the assessment of the heart and neck vessels. So before we start to the actual procedure, the first thing we want to do is to identify the client or the patient. So we identify the client first in order to ensure that the client's identity will match with the correct treatment or to ensure that the clients will receive the service and treatment intended for them. So, good day ma'am. I am Maria Andrea Somoria. I will be your student nurse for today. Can you kindly confirm your name and your birthday?
I'm Edita de los Santos Somoria. Birthday is October 17, 1970.
And how old are you ma'am?
I'm 52 years old.
Okay. So, ma'am, we'll be doing the assessment for your heart and neck vessels. So, we do this assessment to ensure that everything is normal on your heart and neck vessels. But if I have noticed any abnormalities, I will note them for further evaluation and observation and to prevent further complications. I will be asking for your consent because I will be touching some of your body if that's okay with you.
Okay.
So also remember that if there are any curtains, doors in the room, we have to close them in order to provide a privacy for the patient. So, ma'am, before we start, I have some questions for you. First, so, ma'am, do you have any chest pain?
Wala.
Do you easily tire or do you experience fatigues?
Wala.
How about do you have difficulty in breathing?
Wala.
Do you experience dizziness,
Wala.
palpitations,
Wala.
swelling in your feet, ankles, and legs?
Wala.
Next is have you been diagnosed with heart defects or murmur?
Wala.
Have you ever had heart surgery before?
Wala.
How about is there a history of your family and hypertension,
Wala.
myocardial infarction,
Wala.
coronary heart disease,
Wala.
elevated cholesterol,
Wala.
and diabetes mellitus?
Wala.
Do you smoke, ma'am?
Hindi.
And what type of stress do you have and how do you cope with it? Kumbaga, ano po yung mga stress na nararanasan nyo and ano po yung ginagawa nyo para mawala yung stress na to?
Stress ko. Yung sa anak ko. Pag walang pera. Yun.
Paano nyo po yung tatanggal yung stress na yun?
Lumalabas ako. Naglilibang ako. Ganun lang.
Do you exercise po ba?
Hindi.
Have you ever had an ECG?
Hindi.
Do you take medications or use other treatments for heart disease?
Hindi.
And lastly, do you monitor your own heart rate or blood pressure? So now we can actually proceed to the actual procedure. But before that, I have to perform a proper hand hygiene first by applying alcohol sanitizer on my hands. So now we'll proceed to the first part of the assessment. So first, I will be inspecting the jugular venous pulse of the client by observing it. So the client should be in a supine position, 30 to 45 degrees. So I will be standing by the client and I will be asking you to get in head. So we inspect the jugular venous pulse to look for the increase central venous pressure. Next is I will be palpating the carotid arteries. So I'll be using my finger pads, my index and my middle finger pads. So I will be palpating the carotid arteries to know the amplitude or the strength, the contour of the pulse, and also to feel for any vibrations or feelings. Mhm. Mhm. So I've noticed that it has an equal strength bilaterally. Next is I will be auscultating the carotid arteries in the neck. So this is to listen for any fluids such as blowing or squeezing or any abnormal sounds. So I will be asking you, ma'am, to inhale, exhale, and hold your breath for a moment. So I will be using the bell of my stethoscope. So tilt your head and here. So first is the angle of the jaw. Inhale, exhale, hold. Next is the mid-cervical area here. So inhale, exhale, hold. Okay. Next is the base of the neck. Inhale, exhale, hold. Okay, that's good. So I do not hear any blowing or squishing. So next, I will be measuring the jugular venous pressure using a ruler. So this is the sternal leg sternum muscle. Mm, mm, mm. So it is 3 centimeter. So next, we'll now proceed to the heart pericardium. So first, I will be inspecting for the palpitations. So ma'am, can you please hold your hold your face? So I am looking for any abnormal pulsations and apical impulses. Can you hold your left breast and here? Okay. Next is can you hold your ass? Okay. I don't notice any abnormal palpitations in the pericardium of the client. Next is I will be palpating the apical impulse of the client. So I will be using my palm and my finger pads. Here. So it is located in the mitral area, mid-clavicular area, 4th to 5th intercostal spaces. First, I will be using my palm.
Ano?
Here. And then, if you already detected, use the finger pads for accurate palpation. It is to measure the strength, location, duration of the pulse. Next is I will be palpate for the abnormal vibration or pulsation. So first is the left sternal border here. Next is in the base of the heart. This is the sternum. One, two, here. And the next is the apex of the heart, which is here in the fifth, 4 to 5 internal spaces, intercostal spaces. So I don't feel any vibrations or abnormal pulsations. Next is I will be palpating for the heart sounds. So I will be using my stethoscope and the diaphragm. This is to assess the strength and the rhythm of the pulsations. So we'll now begin on the apex of the heart of the client. Here. So I also hear the love dub, the S1 and S2. So I don't hear any abnormalities and it is in a regular rhythm. But if you do notice a irregular rhythm, we'll do the pulse rate deficit. This is where you will auscultate the apical pulse while also palpating the radial pulse. Next is I will be auscultating for the extra heart sounds. So this is to listen for any clicks or murmurs. So we'll start to the aortic.
Saan nga?
Here,
Pa-check up? No.
the pulmonic. The base of the heart.
Ano sabi? Ano sabi?
And the apex of the heart again. Okay, so I don't hear any murmurs or clicks. But if there are any extra heart sounds you hear or there are any clicks and murmur, you have to note the characteristics, the quality, location, the pitch, if the pitch also. So note them to further evaluate. Next is I will be auscultating the S1 and S2 to note the location and strength pattern. So at the base, and the apex. So the S1 is heard loudest at the apex, while the S2 is heard loudest at the base of the heart. Lastly, I will be auscultating the left lateral position. So, and this, sit. Then lean forward like this. And I will be asking you to exhale. 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 Inhale. Exhale. So I will be listening at the apex. It is along the left sternal border. Okay. So as I listen for S1 and S2, I don't hear any abnormal sounds and I don't hear any murmurs. And that's all for the assessment of heart and neck vessels. So if I have noticed any abnormalities in the heart and vessels of the clients, I will be referring him to the other professional health provider in order for further evaluation and observation. So that's all, ma'am. That's the end of the assessment. Thank you for your cooperation.
Thank you.